Epiphany. Epiphany stands for Effective Performance Insight for the Future. Epiphany is a structured learning and teaching approach for junior doctors. It gives them the confidence and competence to perform safely in clinical surroundings. By recognising that a one-size-fits-all approach is not appropriate, Epiphany creates opportunities for individuals to gain better insight into what their learning needs are. Experienced healthcare professionals, such as pharmacists, nurses and doctors, support junior doctors to improve their clinical diagnostic decision-making skills so they are able to learn and work safely in clinical practice. Epiphany essentially develops the ability of junior doctors to plan, monitor, reflect and change how they perform in simulated practice and real-life situations. The need for Epiphany was identified due to high levels of stress and anxiety reported by newly qualified doctors entering the workplace and the transition from one job to another. Less time available for junior doctors to consolidate their on-the-job learning because of the demands of frontline care. Less time for senior doctors to give just-in-time feedback due to their clinical workload. This is the Epiphany process across a typical 4-month junior doctor rotation. Week 1. Junior doctors are invited to an informal meet and greet event with educators where the Epiphany process is described and discussed so they can make the most of it. Week 2. Junior doctors complete a series of directly observed clinical encounters with real patients in a training centre or in the workplace to practice real-life clinical diagnostic decision-making. They practice taking a lead role during consultations on a ward round, performing handover with each other, discussing management plans as part of a board round with senior colleagues. Each clinical encounter is digitally recorded so the events can be used with educators for case-based discussions, also known as CBDs, and mini clinical evaluation exercises, also known as mini CEXs. Week 3, 5, 7 and 9. In the first few months, junior doctors are invited to undertake workplace-based assessments in a dedicated feedback clinic with a medical nursing or pharmacy educator. The feedback comprises giving information to the junior doctor about which aspects of the task were completed. These include the techniques and strategies used, the degree of self-monitoring demonstrated, the degree of self-confidence demonstrated. These will be relative to the quality of their performance on the task. Other components of the feedback include information about human factors, teamworking and leadership skills, as well as a narrative from the patient to the doctor about their performance. Week 6 onwards. Clinical educators continue the educational process at the point of care using the same components for giving feedback on tasks such as prescribing or handover. Likewise, general teaching to address applied knowledge gaps are delivered at the bedside or in a one-to-one or group-based format as appropriate. Junior doctors are also provided access to clinical decision support and e-learning technologies. This helps them develop their digital literacy skills, as well as giving them insight on how best to use these resources at the point of care to protect patients from harm. Week 16. By the end of the course, junior doctors feel confident, competent and ready to practice. The philosophy and values of Epiphany make the difference. The Epiphany approach to education results in greater trust between learners and teachers. The Epiphany process creates a respectful relationship between teacher and learner, where continuous feedback, personal and professional development for both parties are the outcome. Here are some testimonies from junior doctors who have experience of Epiphany.
It's excellent in that it's very focused, and it's all based on our own ability and our own knowledge in certain areas, rather than just sitting in a lecture and consuming information.
It's more to help improve our confidence in our own decision-making process and our judgment, and so I think Epiphany really does help with that.
And to have personalized feedback with video feedback as well as from different health professionals is a useful tool to have, and it's useful to have it at the start of your rotation as we have at the end of our rotation as well.
To find out more about Epiphany, go to www.epiphany.co.uk.